Hi, this video will present to you the details on how to prevent a code yellow, the procedure to undertake when a code yellow needs to be called, and what to do following a code yellow. This video is approximately 11 minutes. I hope you enjoy. A code yellow refers to the procedure to put in place when a patient has gone missing. We all have a role to play in preventing and reducing the number of code yellows that occur within our institution. Let's talk about prevention using a clinical case study. On admission, Julie, the nurse, will evaluate whether Mr. Sauveur is known for behaviors of wandering at home. This will have to be checked with the patient's family. If he accepts to be hospitalized, and if he presents a danger to him or others. Following her assessment, Nurse Julie must put in place the appropriate preventive measures, chosen according to the risk that Mr. Sauveur presents with. This prevention algorithm shows you various preventive methods in accordance to the level of risk that a patient presents with. In red, you find high-risk patients, such as suicidal patient or patient kept under confinement. In yellow are patients identified as potential risk, which include those with cognitive disorders, eating disorders, an altered state of consciousness, or delirium. And in white are the patients who do not present any danger to themselves or others. Who are the patients who are considered dangerous to themselves or others? Patients that fall into this category are those who are suicidal or those under confinement, and this includes as well those under the Tribunal administratif du Québec. For these patients, preventive interventions that should be implemented during admission include thinking about removing and putting the personal belongings locked in a safe place. Note that when a patient under the age of 14 is missing, he or she is also considered to be at a high risk due to their young age. Let's talk about patients with a mental state considered potentially dangerous for themselves or others. These include patients with a cognitive disorder, delirium, or altered mental state. For these patients, as a preventative intervention, we should put a yellow bracelet on their wrist as a simple visual marker. This bracelet will inform all members of the clinical team to monitor this patient. As another preventive intervention, there is the anti-wandering bracelet, which is available on most of our sites except the Glen. This bracelet will activate a bell when a patient is near an exit door. Other preventive interventions that can be used include increasing the monitoring interval to every 30 minutes, for example. If the risk present is higher, the clinical team may decide to start a code yellow form, which allows you to include the patient description as well as a picture. Of course, if you put a patient's picture on the form, you must have the patient's consent or the family's consent, and you must ensure that you follow the MUHC policy. For patients with an eating disorder, please follow their individualized intervention plan. For patients who do not pose a risk for themselves or others, ask them to notify you when they leave the unit for personal reasons, whether it be to have a coffee or a smoke. Also, ask them to return within 2 hours maximum. Moreover, see our campaign poster with this information. The patients with no identified risk may leave the unit for any kind of reasons. Although it may worry you, it is important to remember that it is their choice and their right to leave. Now, let's talk about the Code Yellow procedure. The Code Yellow procedure consists of three levels of intervention. At level 1, a search is carried out on the care unit. At level 2, a search is carried out in the hospital. And at level 3, it is carried out outside the hospital. Let's look at more in-depth scenario. Here is a scenario of a patient who presents with high risk. Oh no! I believe that Mr. Silver has escaped from the unit. Julie will now verify Mr. Silver's chart and verify the mental state that he presented in. She'll also verify whether he's suicidal, on confinement, or less than 14 years old. If Mr. Silver had a mental status that was dangerous to himself or to others, a level 1 and 2 must be activated simultaneously. The search simultaneously occurs on the unit at level 1 and all around in the hospital at level 2. For level 2, Nurse Julie contacts the emergency line of the call center at 55555, and the call center will contact the security service, and they will also announce a code yellow overhead. The hospital search is carried out by the security department. Quickly, Nurse Julie tries to contact the patient's cell phone, their home, or some of their family members. Then, still at level 2, the nurse contacts her supervisor, the doctor, as well as the social worker. If after 20 minutes of searching, the high-risk patient is not found, Fred, the head of security, contacts Julie to activate level 3. At level 3, the call center will initiate and call the people listed here. At level 3, Nurse Julie reattempts to call the patient's home, their family, and also contacts the doctor, her supervisor, and the social worker again to give them a mise à jour. To undertake the search at level 3, the police will need information about the patient, information about his physical description, his legal status, and his clinical situation. Please note that at level 3, it will be the emergency measure coordinator that will follow up with the police forces. Here are various documents to fill out throughout the event, such as a Code Yellow form, which will be kept on file, an incident report, as well as your nursing notes. Now, let's take a closer look at the situation of a potentially risky patient. For this type of patient, as soon as you notice that he or she is missing on a care unit, you enable level 1 with a search on the unit. And if the patient is not found after the search of the unit, you inform the call center at 55555, which will make the announcement on the intercom, and they will inform the security service. Following which Fred and his colleagues will begin the search in the hospital. For this potentially risky patient, it is also important to contact him via his cell phone, his family, or his home. And Julie ensures to advise her supervisor, the physician, and the social worker. After 45 minutes of searching, if the patient has not been found, Fred will contact Nurse Julie, who must then trigger level 3 of intervention. That is, with the support of the police. For patients with no risk for themselves or others, we recommend that you wait 2 hours after noticing that he or she has disappeared before activating the level 1 intervention. Here is a summary for this type of patient. This slide summarizes high risk and potentially risky situations. To better understand the roles and responsibilities of everyone during a code yellow, and to see in detail the algorithm on the procedure on a code yellow, go to our MUHC intranet site in the section of emergency measures or in the section of policies and procedure. These following slides show all the members part of the Code Yellow Committee. For all questions related to the Code Yellow protocol, contact me, Nancy Turner. Thank you for your attention.